Well, thanks so much for joining Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we are welcomed by Dr. David Fryburg, who is the co-founder and president of Envision Kindness. Thanks so much for being here.
Thank you.
We are so happy to have this conversation because you were sharing remarkable stats in the pre-interview with us about how just viewing kind photos can have an exponential increase on the way that people are feeling, even over positive images, which is fascinating. And so the way you got here is also a pretty fascinating story. You had a long journey, but in short, you started as a doctor, you're a practicing endocrinologist, or you were, and then you went into pharma, you did research, you came to all these things, but ultimately seeing news and being weighed down by that struck you of just the effect that it was having, and you wanted to find a way to overcome this, which led you to founding the company. So why don't you tell us, how did you get to this point and realize that visual images could have such a tangible impact on kindness?
So thank you for that introduction. And there's you summarized it or encapsulated it very well. There's a um, there's a known literature actually on the effect of how uplifting videos or seeing kindness in action in person affects people, right? And I'm sure a lot of the people who are watching this video may reflect back of something that they saw and then how they felt. And in that, the neuropsychology, neurophysiology that's occurring is that there's activation of reward centers in the brain, that there's release of endorphins, there's release of oxytocin, there's vagal nerve activation. There's evidence for a good amount of physiologic, systemic, and neurologic response to seeing this. So it explains what positive psychologists and earlier Thomas Jefferson had called elevation. We came to it as a natural antidote, if you will, to seeing images of greed and violence and anger that are pervasive in the news, as well as things of envy that occur often through social media kind of delivery channels. We wanted to help rebalance that. And so we had to figure out a way to do that.
And David, I guess that's a good place for me to jump in with, Stephanie had mentioned, as you started to study this, you and your collaborators, the psychologists who were helping you, were just blown away at the impact you saw of sharing images of kindness. So what I really appreciate about you and your journey is the depth of scientific rigor that you brought to it. So maybe you can share some of that with your audience. What were some of those initial studies that you did that helped you realize the dramatic impact that these positive images, and actually, sorry, I should say more than positive images, these kindness images can really have on us?
So to define for folks, positive images are things that uplift people in general. There are puppies in a basket, bunnies, flowers, kittens, even in this case, a mother and child. And so what people were exhorting us to do was to put science and rigor behind this and show some of the differences. So we did a study in 400 people. This was over the internet. And what happened was with the 400 people, I'm sorry, 100 assigned to each cell of negative images, violence, anger, etc. Neutral doorknobs, towels, light switches, and positive images is what I just described, all came from a set which is known as the International Effective Picture System, or IAPS. And we compared them to kindness images of even things that might be distressing. A woman in distress on a dark stairwell being comforted by a police officer. A sea of shaven heads with one face looking up, and it's a young man going for chemotherapy, and his friends shaved their heads in support. And then we asked them, how did they respond emotionally? And what was totally surprising to everybody is that the kindness images had double the impact, 100% the effect size of the positive images on joy, love, trust, optimism, soaring increases in sympathy and compassion. We invoked the feeling of elevation that was classically described and people feeling inspired. And that said there was something important here. So we went on to eventually, we had to figure out how to deliver these images, which I can describe, and then study them in situ, in the field where they're being used. And what we realized at the time was also that there were video studies in media psychology academic labs that had known about this for quite a while, that 2 minutes of a clip from Oprah, or there's a Thai company that had made some beautiful videos, that these short pieces would both inspire and elevate and induce joy, as well as change behavior as measured by generosity. And I can then take it into the healthcare setting if you'd like.
Sure. How does that play out in the healthcare setting? And by the way, I was just thinking when you were saying that, I kept thinking of the Dawn commercial with the duck, of them really taking the oil off of it. Because that has to be one of them. They're helping this duck, and every time I'm like, the duck commercial's on. It's so cute. And then you're
Well,
just like, oh, I
and
don't want them to be stuck in the oil.
that's a beautiful image in and of itself, and you described it and you captured it really well. What it turns out also is that companies are more appreciated by consumers, or better said, consumers appreciate companies that have pro-social affiliations. There are examples of that in Tom shoes and Bombas socks, etc., where they're donating a pair for every pair that's purchased. That kind, Patagonia, that works for the environment. It's because we're really wired to do good. The reason why this works, and I'll describe the healthcare stuff in a sec, is we're wired that way. It's just life circumstances get in our way, and the other media and daily stressors affect this balance of how we can give and feel connected to other people. So in healthcare, we first experimented with doing the typical delivery methods over social media and email, and realized that wasn't going to work. There was too much of a selection biases of different kinds, and we needed to just be mainstream and reach people right where they have stress. Because one of the incredible things is, if we're inducing joy and uplifting people, we could expect that their stressors would drop. So we decided, okay, we'll stream it right into the stressful environments. And we picked healthcare first because, I know, and as do so many others, that patients have a lot of stress. They're sitting in the waiting room and they're stressed, looking at the time, and is the doc going to find something wrong with me? Is the doc going to listen to me? Are people going to care about me? They've got this running thing in their heads, and it's understandable. I have it also, and I am more informed than most. So, well, what if we did that, and we went also to try to help the staff, because the staff are trying to maintain their timing, and they're under, they've got a certain number of patients, and they've got to address issues, and they want to be of help. But they've got their own set of problems as well as whatever they bring in. So they bring in their stressors from outside. They just don't leave them at home. It's impossible. So the intent was, okay, we'll turn this into video. We collected images from around the world through crowdsourced mechanism of a international kindness photography contest that we've run for 5 years now. And we then take the images and use a Ken Burns-like method, stream and turn them into video. a short form, 30 seconds to 2 minutes, and then we complement it with other media. And then, of course, we had to go study it because I don't want you to take my word for it. It's like, okay, here are data. And we did the first study before the pandemic began, and it showed exactly the same thing that media psychologists were seeing in academic studies. Oftentimes those are college students or internet-based studies. And that is, people were happier, they were calmer, they were more grateful, they were inspired and uplifted. This is all within a few minutes. And it was compared to children. This was a pediatric facility, so children's television. They also made a donation to a needy family, much more likely if they watched the kindness media versus the children's media. All exactly consistent with the academic literature. So then we went on to study it elsewhere, and we started in one hospital in particular, an academic hospital that was very interested in working on this. And they did a patient focus panel, which showed that within one video, and I can show that video, that people within 2 minutes had less irritation, about almost 90% of the folks who participated, less stress, less sadness, less anxiety, more happiness or joy, more calm, more gratitude, feeling connected to others. And as a flyer of a question, we asked them, how cared for do you feel? And it's a video about hugs. It has nothing to do with medicine, that directly do with medicine. And 2/3 of them were felt much more cared for. So it talked about the sense of feeling connected to others. And so then we studied it in the hallways of this hospital, and we rolled it out on floors and surveys for the staff. And there's a small effect over 2 weeks, but it's there, particularly for the nursing staff. At treating each other, they're evaluating how they're being treated with respect and civility and compassion, and how they're listening to others, and how they're managing their stress, etc. That had nothing to do with the media. And then what we've done is we studied it in an ER, and it was added to the discharge surveys. And they added some questions where it said, if you watch television, did you see the kindness media? Because half the televisions were commercial television, half of them were kindness media. That's how they wanted to do it. And 56% of the people who said that they saw the kindness media, weeks later, when they completed this survey, felt more positive. And then they've recently shared, and we're working on finishing analyzing the data, but the preliminary take home of giving us the Press Ganey-like questions. Did it affect, these people were more positive, but did that translate to a more satisfying experience? And the answer is yes. Across almost every single question that they were asked about how the nurse communicated, the doc communicated, what their experience was like, the recommendation of the ER, all of those, again, it's preliminary, but the data are looking very strong, which is why I'm mentioning it. Is very encouraging, because then it makes sense, right? People who are more optimistic are in better moods, have a better perspective. And then they will interact more kindly with others. So to your wonderful goals about how do you, share and promote love, it's this, paternal, not obviously not romantic, but and paternal's it's not the right word. A sense of feeling connected to others and being part of a greater whole and strengthened community. This is what's attracted me to this so much. So we're accumulating data, we're receiving more grants, and doing more studies to ask, does this affect even longer term outcomes? How can this affect burnout? Because providers, right, they're there because they want to take care of people. That's their motivation. It's out of love, right? Isn't that the natural, the application of modern medical science or biology to with love and caring?
What you were just saying there again is about the love. It is love, but it's not in like a romantic way. It's just love. And a Apoorv, I've said this before. When we had this conversation, what do we call it? Is it love? Is it compassion? Is it whatever? He said, well, if it's compassion, are we only like, what happens when there's nothing to be compassionate about? They're not ill. Do we just not care? Whereas love happens all the time. And so I thought that was one of the best conversations that he and I have had. With that, this conversation has gone very quickly. So it is already time for the final question.
Wow. Yeah, thank you, Stephanie, for underscoring that as well. It's a general milieu that of love or kindness that we're trying to create. And David, I think that's what strikes me about what you have done is that you're bringing this into our background, almost into our subconsciousness. It doesn't even require the patient to do anything differently. It doesn't require the nurse or the doctor to do anything differently. It's just there, and if you imbibe it, it improves the way you feel, and it's amazing that it could have an impact even 2 weeks later. So I'm really just blown away by how elegant and simple and straightforward of a solution this is. I guess my question coming out of that, David, is have you been able to study enough what the right frequency of this mechanism should be? If you think of it as a, we didn't get to discuss this here, but if you think of it as a prescription, so to speak, that Stephanie was getting into earlier, how often should it be dosed? Is it a daily thing? Is it weekly? Is it continuous? Do you have any sense on what that dose response relationship would be for something like kindness?
It's a great question. I don't know the answer yet, but I do have some inkling to it, as well as how hungry people are for this. So, what we had recently received was unsolicited feedback from a dentist's office where we're displaying media. And the dentist was talking about how it's changed the ambiance of his practice. That to him is undeniable. And to invoke a more compassionate, caring environment. But the patient's unsolicited feedback that also came included from a person who came to sit in the waiting room on days that she didn't have an appointment, just to watch the media. So that, and when we did our last contest in 2023, we got requests from a German news magazine for images, which led to many magazines, publications in Germany requesting them. And so what it was saying was there's this deep hunger for it. So what my best guess to your question is that it would be great if it was daily. But our intention is to keep microdosing. So, and to your other point about it being subconscious is incredibly important because people don't need to train for this. They don't need to study anything. They just need to watch it because it's innate. It activates, it is subconscious, as you said, it activates this innate drive to want to connect and care for others. So we still have to figure that out, but we are, that will be on the list. But finding ways to deliver media regularly to people is the key, and study it.
Thank you so much for being here and sharing this conversation. This was fantastic.
Thank you. I really appreciate the invitation. You both are fantastic.
Thank you, David. This was so elevating for us. Incredible work that you're doing, and thank you for sharing it.
Thank you all for
My
watching.
pleasure.
We'll talk to you soon. Bye-bye.